Ladies and gentlemen, and Mrs. Hicks, thank you for giving me a few moments to speak about something that is very near and dear to my heart: superheroes. With the latest installments of the Avengers in the theaters, I thought it would be fun to discuss the movie. Just joking. I promise no spoilers. In fact, I'm here to celebrate my own personal superheroes, the respiratory therapists that have come to mean so much to JC and to me. I'm eternally grateful to the respiratory therapist at UC Davis Hospital. I know other doctors and nurses call him snot jokies and that they work like a spit bit. But to be honest, they're the reason my son can wake me up every day at 6 in the morning screaming, "Wake up, Mom! The trash truck is coming today!" By the way, the trash truck only comes on Wednesdays, but he does this every day just to make sure. Part of my son's condition means that one of his lungs is smaller than the other and that his bronchial branches are floppy. It's kind of like trying to suck air to a flat, long tube. The harder you suck, the flatter the tube gets. The only way he can breathe properly is if air is constantly blowing in his lungs to keep his bronchial tubes open. Imagine talking while inhaling. That's what it is for a patient ventilated with a trach. In other words, my son. I know this I know this because respiratory therapists known as RTs explained it to me in a way I could understand. They knew how scary it was for me to face with a hole being put in my son's throat and that he will need a machine to breathe for him. They were there for me in every way. They were patient, kind, and understanding. And most importantly, they trained my son like one of their own. To this day, Shirley, Brian, and Stephanie visit my son at UC Davis even when he's not one of their patients. One time, one time, Brian brought him a Starbucks Frappuccino because my 4-year-old wanted a Starbucks. Of course, decaffeinated. According to JC, Shirley's his girlfriend, and he loves to flirt with her. I think she likes it too. I imagine it's not easy in developing relationships with fragile patients and the sadness that comes when even the best medical care isn't enough. Both Shelley and Stephanie said that the hardest part of the job is watching a patient struggling to breathe. But that didn't stop the RTs from doing their very best work to give my son his possible outcome. They love celebrating Jason's success and his fighting spirit. There are so many things that need to be considered when dealing with the ventilated patients. The size of a trach, for example. If it's too big, the windpipe will become stiff. If it's too small, the air leaks out before getting into the patient's lungs. The settings on the vent have to count on how much the air pushed, how hard and how often. My son then can even adapt to Chase's breathing, at first to encourage him to breathe on his own. I don't quite understand this, but the RTs know. Get the settings wrong and the patient will be at risk of a hyper or hypoventilations, too much or too little air. Against the odds, which I found outstanding, my son can not only talk around his trach, but actually yell. He and his nurse love to belt out It's a Small World over and over. I keep telling myself it's just a gift, but I really need them to learn another song. He can do this because the RTs know their business. They train for 2 to 4 years and they have to pass a state license exam. UC Davis has rigorous hiring process that ensures only the best RTs are on staff. I'm so thankful for this. I would have been terrified to have my infant home if the artist didn't do a great job training me to handle all the tasks necessary to keep my son airway clear. Thanks to them, I know what all the different alarm means. I understand what the vent setting should be and when they need to be changed. I can change the tubing like a pro. They took the time to teach me everything while my son was in the hospital. So I can be confident at home, taking him home. They were always encouraging and never made me feel stupid or inept. I know this is their job, but there are many ways to do a job. Somehow my artists managed to be professional and personable at the same time, though they never brought me a frappuccino. Just saying. In case you're wondering if all the artists are this way, let me assure you they're not. There's some artists that come over to the house to check my son's vent. They just come, check the vents, take notes, and they leave. They don't even take the time to ask me questions or to see if I have any questions or to look at my son. Or when they order a replacement part for the machine that they're supposed to be helping my son breathe. So believe me when I tell you, finding a good artist is like finding a good mechanic. They're precious. I have been so blessed to find the three artists that I mentioned today. I am and I'm always will be grateful for the artists. I look forward to a time when my son won't be vent dependent anymore. He can already be off his vent most of the day. He only needs it at night. He speaks with the speaking valve that allows him to push air past his perfectly sized trach through his vocal cords to tell me, "Mom, get up, the trash truck's coming today," every single day.